The Caribbean has made significant progress over the past decade in introducing and expanding the Human Papillomavirus, HPV, vaccine.
Okay, well, let me first start by saying that it was a free pap smear. That is what helped me to find out what was wrong with me, and I didn't know. So I was diagnosed with cervical cancer stage 1B1. What did that mean to me as a young person? I was in my early 20s.
I must say, to me personally, it's a really big deal. When I was appointed minister in 2023, and subsequently Minister for Health for the OHCS region, one of the things I wanted to focus on was preventative medicine. So reaching over 90% HPV for 2 consecutive years is a tremendous achievement for the British Virgin Islands.
Achieving 93% HPV vaccination coverage required strong coordination and clear national leadership. The ministry played a central role in aligning all partners, healthcare providers, schools, community stakeholders, and PAHO.
So that's an extremely important achievement. Essentially, we have achieved our objective with regards to the population at risk. So as they age, those cohorts of persons will become persons who will be less likely to develop cervical cancer.
Meeting the people where they are and knowing your people, and then for me it's from church, it's from school, it's from the community. Any mother or parent I met with a child, one of the first they would say, "Nurse, remember this child?" I say, "Okay, fine, yes, I remember. Is your child up to date with his vaccines or with her vaccines?" You know, so when you meet them in the supermarket, you ask them, you meet them in church, you ask them wherever function you attend and you meet them. But it is my passion.
As with all vaccines, I think initially the students were not very happy about receiving a vaccine. However, we work closely with Nurse Hutchinson, and she normally sends us all the material which we share with parents. So we shared all of that information with parents and gave the parents an opportunity to speak to their children about the vaccine. And once that was done, we had quite a few students who signed up for the vaccines. I think the students were happy that, you know, the school was taking initiative to more or less make sure that they were protected. There were 1 or 2 students who wanted to know more, still came and asked more questions about the HPV vaccine. And then, of course, parents were very happy that we were able to work along with the BVI HSA and procure the vaccines, right here at school. So I think it was an absolutely great initiative. Once they came and they had the vaccine, they said to, you know, the person coming after, "It's not that bad, it's okay." So I think it was just a little bit of fear initially on their part, but they understood the importance of it. And we are happy to be working with Nurse Hutchinson and her team in the future as well. So yes.
I think as a parent, it's our responsibility to always do your own research. You know, the HPV vaccine is an incredibly safe vaccine. I don't just believe in just injecting your child with anything. I believe as a parent, you need to focus on the trials that have happened. The HPV vaccine is renowned as an incredibly safe vaccine, and it has very mild side effects from the vaccine itself. So I have 2 children. I have a daughter who I wanted to receive the vaccine because it will protect her as she grows older. She's 16 now, so having it as a preventative vaccine was really important to me to protect her against cervical cancer. And I have a son, so I also thought it was really important that he should be vaccinated too, to protect not just him, but any future partners that he may have from the HPV
But I think one of the fundamental lessons that we've learned here in the British Virgin Islands is partnerships. Partnerships with the schools and the Ministry of Education, partnerships with nonprofit organizations, partnerships with even faith-based groups in order to spread the word. And so in doing that, there's more sustainability because you have more persons that buy in to the mission of getting rid of the disease.
Okay, first and foremost, we noticed that most of our students in the BVI, including myself, time we hear about vaccines or injections, fear comes. And that apparently was the very same reaction that we got from our students. They were very fearful once they hear, they would ask, are we going to get injections? So that triggered fear in them. So that was the very first thing that we noticed about them.
So initially, as she said, they were a bit hesitant. But with further education, right, and of course, when they saw others getting it and realizing that, hey, it's not such a big deal after all, they gradually warmed up to it, as well as even the parents.
I think it's important because this is the place where the students spend most of their waking hours, and we have them in our care from about 8 to about 5, sometimes even later. So here they spend a lot of time with us, and we have a lot to invest in and we have a lot to share with them. So I think bringing this into the schools was one of the best initiatives in order to get this information across to help educate them about the HPV vaccine.
Right, and also at this age, they're usually very impressionable. Right, and this is also a very critical phase of their life. So I believe the earlier you get to them, it will be the better for them going forward.
I think of the vaccine as a way for me to give my child a better opportunity to be healthier. I know cervical cancer is a rising problem in the Caribbean, and this is one way for me to assist her in being able to have a choice. Rather than just seeing what happens, I get to try to make a choice that helps her to be healthier long term. I think it's important. I mean, obviously everybody has the opportunity to choose to do what they want to do, but to give your kids the healthiest chance possible while they may not necessarily have the best capability to be able to make that choice for themselves. So if we can do something that, I don't know which parent wouldn't choose to do something that would actually give their child an opportunity to be healthier in the long term. I know some concerns around the vaccine, around sexual behavior, that type of thing. So I would hope if I can help my daughter to avoid certain mistakes or certain consequences from mistakes in the future. If I can give her that opportunity, then I would. And that is not a promotion of being irresponsible, just an in-case mechanism. Furthermore, to my understanding, not all cases of HPV are sexually related anyway. So I don't see the negative. I don't see much of a negative in choosing to actually give your child a vaccine. So it's something to consider if you want to help them in the future now. So my decision to vaccinate my daughter was made through exposure in the private clinic. However, she received the vaccine through the public health initiative through the school vaccination program.
I remember when my dad told me I had to take the vaccine. When I arrived to the clinic, I was a little scared because I didn't really like the needle. It makes me feel good because I wouldn't get any of the cancers if I take the vaccine. My mom died from cancer, and I want to take the vaccine so it can protect me from getting that.
I know that they are scared, I know that they are concerned, but this vaccine has been tested, it is safe. My wife passed away from cancer, and so I want to protect her, and not just only her, but the entire youth population of the BVI.
Okay, Okay, there was no real magic pill to increase the HPV coverage, but we found that a few strategies work. One, provider targeted communication, help provider professional guidance and encouragement, particularly from nurses, especially Nurse Weena Hutchinson. That was very essential. How the individual conversation she held with parents and guardians were very impactful. We also shifted from a health facility base to a school-based vaccination program. And this offered a convenient setting for the adolescents, reducing the need for parents or guardians to take time off from work to go to the clinic.
Because I think that I'm living proof that you can bounce back from anything. You don't have to stay where you were. You can move forward to get to where you need to be, but it takes a positive mind and a positive attitude. And so that's why I think that the vaccines, just understanding it now makes so much sense.